Reena Gupta, Senior Consultant, Fertility and IVF Specialist at Cloudnine Vikaspuri branch. Today in this video, we will talk about IVF after the age of 40. So the success rate of IVF depends on many factors, but the most important factor which tells us whether the IVF will be successful or not while we are counseling the patient is the age of the female partner. As the age of the female partner increases after 35, the success rate of IVF decreases, and it decreases more so after the age of 40. Why? Because after 35 years of age, it's not only the number of eggs which keeps on decreasing, it is also the quality of the eggs. And when I say quality of the eggs, it is the problem in the genetic makeup of the eggs. That means the eggs can be genetically abnormal, which can lead to failure of IVF, which can lead to miscarriage, or it can lead to an abnormal child like Down syndrome you must have heard of. So all these problems like failed IVF, miscarriage, and having an abnormal child, the chances of all these things will increase after the age of 35 and more so after the age of 40. So जब हम statistically देखते हैं, we've done so many studies so far, so we've seen कि 40 years के बाद the chances of having a successful IVF or having a live birth is after 40 years is just 12 to 15%. And the reason is that the eggs are mostly 90% of the eggs at the age of 40 are genetically abnormal. जिसमें या तो there will be no good embryo formation, or there will be a failed IVF, or there will be a miscarriage or an abnormal child. But now with newer advanced techniques, we can increase this success rate of IVF after the age of 40 also. How we can do that? Now we have a advanced technique in IVF which is known as pre-implantation genetic testing. So as I mentioned that after 35 years, the main reason of failure or miscarriage or abnormal child is the genetic abnormality in the eggs. So before transferring the embryos back in the uterus, we can test them whether they are genetically normal or not. So if you are going for IVF after the age of 40 and you still have good ovarian reserve, that means your number of eggs are good, then we can do IVF, and in the embryos we can do an advanced test which is pre-implantation genetic testing, where we can test the embryos before transferring back that whether their genetic makeup is normal or not. If the genetic makeup of the embryo is found to be normal, then the chances of having a healthy child with the transfer of single genetically normal embryo is around 40-45%, which is as good as when we do IVF in a patient who is less than 35 years. So this is a newer technology in IVF, where after 40 also you can have your own biological child, and that too with a good success rate. But here the main point is that you should have a good ovarian reserve to achieve good number of embryos, where we can find a genetically normal embryo also. So अगर हम ऐसे percentage wise बात करें, तो अगर हम genetic testing नहीं कर रहे हैं तो the chances of healthy child is 15%. But अगर हम genetic testing कर रहे हैं तो chances of having a healthy child is again 40% when we transfer single embryo. The other way of getting pregnant after the age of 40, if your number of eggs are not good, if your embryos are found to be genetically abnormal, is to take the donor eggs, because it is mainly age related. So if we take the eggs from a woman who is younger, then that age factor is bypassed, and then the chances of pregnancy will be the same that is there in a woman who is less than 35 years of age. So this is the main reason that we say that you should get the IVF done at least before the age of 35, because that genetic abnormality, which is a commonest reason of failure of IVF, becomes more after the age of 35 and more so after 40.